much for joining in on our conversations today about EMDR. We're three therapists practicing in different areas, and we went to an EMDR training with Dr. Dobo in Tampa earlier this year, and we ended up being paired together. And part of the training process is that we have to actually do the technique, engage in the therapeutic process with one another as we learn these new skills. And so the three of us were paired, and afterwards we thought, it'd be really great to have a follow-up conversation after we've been implementing it in our practices and just talk about some of the things that we're learning. And so that's what we're here to do. And thank you for joining us. And I'm going to let Elizabeth share a little bit about her and her practice. Elizabeth, can you tell us a little bit about what you do and where you work?
Hi, thank you so much for having us. My name is Elizabeth Rathbun, and I'm a psychologist in Connecticut. I am in the process of getting licensed in Florida as well as a psychologist. I practice mainly in New Haven, Connecticut in person, but I also do a lot of virtual telehealth therapy. I mainly work with people with eating disorders. Probably 80% of my practice is that area of focus. And then there's another area that's a little more general: anxiety, depression, and of course, trauma, a lot of trauma. And with eating disorders come, a lot of that anyway. So addictions, trauma, mood and anxiety disorders. I am a certified eating disorder specialist. So I am really excited about learning EMDR and being trained in it and getting further trained in it. And even just from the last month or two, I've seen a huge change in working with my clients using it.
It's awesome.
In such a positive way. Yeah.
Thank you. And Robert, why don't you share a little bit about who you are and where you practice? And yeah.
Well, thank you for having me as well. Robert Engel, me and my wife opened a private practice in 2021 called Very Good Counseling. We're not trying to be boastful. It's just, it's an ode to one of our favorite TV shows, Parks and Rec, which we talk about all that on our website. So if you have questions about where this silly name came from. I practice in Fort Myers, Florida, but can provide services across the state of Florida. And I'm doing that already online with EMDR therapy through a few different modalities. I specialize in ADHD treatment. I'm a certified ADHD professional. In addition to being trained in some motivational interviewing, some CBT, and now EMDR, in the process of doing that as well to kind of incorporate and be more well-rounded to deal with the more sticky parts of our life, of the human experience, if you will. So right now I'm focusing mainly on building this practice, enjoying my time with my 3-year-old son and 5-year-old corgi. And of course, my wife, my better half, my partner, the CEO of this budding business. And so that's a little bit about me. And I'm just so grateful to be here today and to have a good time talking with you ladies and talking about our experiences with EMDR and how we've incorporated that in our practice.
Yeah, I'm so
and
excited.
How we can really transform people's lives.
Oh, I'm sorry, I cut you off. I think it was like a glitch in the matrix. The technology paused, and I was like, oh, it's an opportunity for me to say, yes, I'm excited too. I'm sorry, Robert. I'm really excited to have this conversation. I've been looking forward to it. I'm Raina Lombardi, and I own Florida Art Therapy Services, which is also a practice in Fort Myers, Florida. Coincidentally, our practices are really, really close, and we ended up meeting in this training, which is wild. And I think our businesses are maybe a mile and a half from one another or something. We're super close. And my specialty is more art therapy and expressive arts therapies. Uh, but I've and I've had a number of therapists in the group do the EMDR training, and the results that they were experiencing with their clients was so amazing that I was like, I think I need to try it for myself. So I started doing my own EMDR therapy for me to kind of see what it was about. And then once I started, I was like, oh, I I definitely have to take this training. I can't put it off any longer. And I'm so glad that we did. And that's kind of led us here to this conversation today. Um, what are some things that you all have been kind of realizing as a new practitioner with EMDR? Well, let's start with you, Elizabeth.
I think that one thing I've been realizing is that this is an ongoing, not that this is a surprise, but it's an ongoing learning journey. And that it's really about stepping out of getting the training, the basic training and the necessary training, and then kind of really individualizing it to each client. And really so much of it, I think, is being a intuitive therapist and trusting, our gut and our experience, and really like knowing our clients and going, really meeting them just as any therapy where they are. And, I think one of the things that I've realized, especially what EMDR really highlights and really shows us where our clients are, especially the beginning process of it. I think that, for example, my really high anxiety clients it comes out as like, am I doing this? What if I do this wrong? I don't know how to do this. This is a lot. This is different. What am I supposed to think or see or feel? Or I don't know if is this okay? Is it, whereas other people maybe are a little more trusting of the process, and maybe it's easier for them to kind of go with it. Or for my clients who tend to struggle with chronic depression, I'm seeing that more in, how they maybe have more numbness around some of their memories, and how they're out of touch a lot with past experiences and traumas. So it's been really interesting, that part of it, to really see people's clinical presentations and really kind of understand where they're struggling and where they might need to really do a lot of the EMDR processing.
Fascinating. What about you, Robert? Anything similar or different to what Elizabeth has been noticing?
Yeah, no, I mean, I definitely agree with that. Certain clients are going to be more or less apt to get in the flow state that you kind of need to jump into, allowing yourself to be present in that moment or in that memory or in that event, which, for a lot of people can be very overwhelming. So avoiding it, wanting to numb it, downplay it, or, it comes up in different ways, like with anxiety or with depression, right? My experience has been a little unique with the variation of the past EMDR takes. I don't know if this has been your guys' experience. When we went through the training, we talked about how really leading up to this, we had to be the expert a lot of the time and be leading the client through something. But with EMDR, we are just a guide, if you will. A person with a lamppost saying, let's hit this target, let's hit this target, let's hit this idea, right? As we go through the EMDR process itself, just trying to use those intuitive skills, like you talked about, Elizabeth, to kind of identify how this might be a core belief or a negative belief about ourselves, or how we've interpreted that through the history of that negative belief, our relationship to that negative belief. So how that is displayed for each person is very individualistic. And not having to be in that process with them, I think is really freeing as a clinician, as in like, I don't have to do all the heavy lifting. I think it's reinforcing the idea that they have the power to heal themselves, which is super empowering for a lot of my clients. They're like, oh my God, I can do that. I can, like, I just tapped when I was at home and it got better. Robert, I'm doing it. And I'm like, you are doing it. Exactly. You know, and I'm not like saying that everyone should just be ready for like self-administered EMDR, because I think it is a process you have to learn, a skill set you have to build out. But you know, there are different variations for that. But I think that part of it has been very transformation, to see my clients be able to grasp and hold of their own change so quickly, changing their emotional state with some of the preparation work that we do before we even start the EMDR process, right? A way to like self-regulate their affect management skills, those kinds of fun things that we always do to prepare them before we do those deeper dives into these really traumatic events. Gives them that sense of, I have that control. I can change my emotional state. I can do this now and also in the moment with my therapist in that room. So,
Mm, yeah, I love that. I love the empowerment piece. That is really such a core aspect of the modality. And I don't know if you've all experienced it all, but a couple of clients have asked me, you know, instead of focusing on the traumatic stuff, can we focus on using this to build something to look forward to in the future? Like, can we do like a more positive focused application with it? And of course we can, which is really, really cool. And it's cool to see how engaging in that process can also lead you back into the negative core belief, but it still gets you back to the positive shift or the adaptive shift. And that is so empowering too, to be able to be on the train, moving all around wherever the subconscious and the body leads you, and then to arrive at like I was focusing on trying to have a positive outcome in the future, but here I am back in this other place. But that really shows where the block is. But by allowing and just going with the flow, as you were talking about, we can come back to the positive, and that negative part, the part that was sticky and trying to pull us back, starts to get broken apart and doesn't have such a strong hold. And that's been really encouraging to see with clients. And I think encouraging in that, you know, those applications aren't as intense as focusing on maybe like core life, big B traumas. I think it helps set the stage of like, this is how we can experience, let's build upon these positive experiences, and then we can go into the stuff that feels more deeply uncomfortable.
yeah, I agree. And that's kind of that tailoring to specifically what your client needs in that moment, right? Like, do we need to build more of that self to feel like we have that sense of control and that sense of purpose and that sense of direction, or do we need to get some relief quickly from these disturbing things from the past, this emotional upheaval that happens every time I'm triggered by this thing, or I go to that place, or I think about that thing. And I think that's the uniqueness, like you talked about with the EMDR, is you can do all those things. You can do a future template, you can do a past template, you can do a present thing, and allowing them to wade through those waters and understand the mechanics of EMDR and how it works for them specifically, because everyone's very unique. Oh, I saw pictures, I saw colors, I was on the train and just a bunch of images are floating past me. Or I'm actually reliving those moments, or I'm reliving that whole thing over and over again, and I don't know why I'm just reliving it. Maybe I've missed something. Maybe I need to go back. Or then it's like, then the adaptive shift happens at certain points of like, well, this really wasn't about me. It was my mom who was upset about my dad's something from 20 years ago, and it's like, bing, that moment that happens. So, but
That
yes, anyways.
clarity, yeah.
Mhm.
Yeah, that clarity is amazing, right? when you were talking, both of you, I was thinking about how, I think we all tend to have our own cognitive distortions around, or I don't even know if that's what we want to call it, styles of thinking around the all or nothing. And I think that often we think this is all bad or all good or all whatever. And I think that the other thing that EMDR does that I'd never really thought about till I'm seeing it now with my clients is the taking away the all or nothing and also allowing people to have, well, this is really negative and awful, and I learned so much, and I realize how I'm doing this differently with other people, or I'm relating in this way, or, it's so interesting to me how it's really helped people, I think, who tend to have more inflexible and rigid thinking to open up more and be more curious and be more flexible. And I think that that's huge. That's something we struggle so much with, at least I struggle with clients, is helping them because they're struggling in their life, being more flexible and kind of maybe rigid in some ways, and it really affects their relationships and work and et cetera. And I think that, EMDR, the ways that it can help somebody and really, the transformations are kind of endless, which is pretty lovely to see. And I knew that there would be a light. I mean, I hope there would be a lightness and the clarity, but I think there's all these other pieces and moving parts that are also shifting, I think, which help shift kind of, it's like it's everything, but it's not all the things. Do you know what I mean? Like, it's like these little twitches and these little shifts and this lightness, and it's like so much, but it's also like subtle. That makes sense.
Yeah, it is very difficult to describe the like overall or the gestalt of it, right? Because it's so complicated and so subtle, and so it's hard to arrive at it. I think that is where, like, having that space in between are, the EMDR appointments, where the individual then has that opportunity to approach real life situations with that new perspective that they gained in the EMDR session, and then, like, report back of, like, oh wow, this, I was in this situation, normally I would respond in this way, I was able to do it this way. Or I had a triggering situation which normally would send me down the rabbit hole for days, and this time it was only there for a couple of hours. And it's that it's like little, but it's huge at the same time.
Yeah, and I think that's the power of EMDR, right? It's so transformative. You have an experience, and this is how it's so different from every other type of therapy. You have an experience in the therapy room with us that informs how you live outside the therapy room, instead of bringing what's in the world into the therapy room and trying to break it down into parts, trying to isolate the event where we could have done something better, try to change how we think, feel, believe, you know, react to things that we have already been stuck in for so long in these patterns. And I think that's the other beautiful part of this, like from like the research that we've done and we're told about, like it literally creates new neural pathways, so that your behavior, your emotional regulation, and your feelings about these things change. So it does break those little things and those big things at the same time, because you literally think differently about that event, and then it informs how you live. That's just been so huge for all my clients that have been successful in doing that and submitting themselves to that process.
I can affirm that that is true even for myself. Like, early on, I did some processing around some childhood events, and that were extremely distressing, where in the moment while I was going through the EMDR process, I was viscerally, emotionally activated, crying, and it was intense. It was like I was reliving that experience again. And then later on, I was processing something completely different. It was about like, building myself up with strength and um, the capacity to deal with something that is difficult, right? And in that um, process, the EMDR, like for me, it's imagery because that's where I live, is in the image. So in the imagery, as it was unfolding, that event was so distressing early on in my sessions. It was there, and I was able to observe it and not have any emotional reaction to it at all. I was able to actually look at it from the perspective of, look at how much strength I had then, right? I was able to see myself empowered versus being a victim at the time. And that was so significant, to be able to have that. And I am excited to be able to do this process with clients so that they can have that experience for themselves too.
Yeah. Thank you for sharing that. I know we all, going through the training, had an experience with EMDR that informed the way in which we live now. I would say in some level. Would we all be okay with kind of sharing a little bit of that process through either the training aspect, or maybe I've done work even since then, doing EMDR specifically on some of the targets that were unfinished or unresolved. Would you guys be okay with talking about some of that stuff?
Oh,
Absolutely.
absolutely.
Okay. I can go first since I'm the one that broached the subject, so you don't feel like you have to.
Sure.
I was already thinking about it. So I guess for me, I agree with, and this is why I wanted to talk about it, because um, you know, we encourage our clients to do things that are uncomfortable a lot of the times, and to kind of push the limits of their belief about themselves, um, in order to change and transform and do something different. I always think of Einstein's definition of insanity: doing the same thing expecting a different result, right? And I always
Totally.
bring that up in some way, in some type form, right? With a client, like, well, we can't do the same thing, and nothing's going to change here. Like, what are we going to do, right? And EMDR does that for you as well in that process. And I think that's what my personal experience had been with it, because my relationship, um, back were very negative. I was in a lot of car accidents. I've been in like other traumatic events as well that we were processing through. You come from a divorced family, there's you can imply a lot of different things from those scenarios, right? So those events had taught me how to think about myself. And I agree. My in the moment relationship to them was, I'm not strong enough to prevent these from happening, or I don't have control, or like if I would have done something different, then maybe there would have been a different result back then, but I don't have the ability to go back in time and change that. But now, through the process of EMDR, those beliefs about myself have changed, because I am, seeing the strength in myself versus the critic in myself, or criticizing myself. And I think that's just, from a lifespan perspective, when you're kids and we go through these traumatic events, we're going to interpret them as we're the problem, or we could have done something different, like a sense of responsibility or a sense of lack of control, right? And then we carry those things into young adulthood and adulthood, and we still think, well, that it happened back then, of course it's going to happen again in the future. And then we relinquish control, relinquish belief in ourselves, relinquish this sense of purpose and direction that we have the ability to change. And I think when I've gone through the EMDR process, looking back on those, and I've recapitulated those things onto not negative, and then installed the positive cognition that I was in control. I have the ability. I am strong. I am capable person. Now my relationship to those memories, one, has changed drastically, like it should, right? Like the distress that I feel, but the relationship with the people in those memories has drastically changed for me. And for me,
Wow.
that's the biggest part of this, that has changed. So
That's amazing.
yeah,
Thank you for being
That is
willing to
amazing.
share that.
yeah, I think it's
Yeah.
important to talk about those things. So
I think that's so important. And I hear you. And I was, whenever I taught, I do the disclosure or the consent and, some of the disclosing. And, when we talk about the part that, are you really ready to do this? Because this can be so transformative that, likely you will change and your relationships will change. And like, those things are really because your perception is changing. And, that's really, I think, that's hard to make tangible when you're reading that to someone. And what does that really mean and look like? I think it can be really scary. Like, what does that mean? And what is my life going to look like? And am I going to come home and be like, I'm leaving my family and I'm going to go do this and I'm not talking to my parents ever again or whatever it is, that it's kind of scary to think like, what does that mean? I know for me, when we were just starting out, that was like really kind of like, ooh, what is that? What's going to happen here? And I think that has been such a huge part for me as well. What I've seen from that is more of, I think in a sense, like from the EMDR processing, what I got was so much more compassion for myself. Then that's able to be shared with the people in my stories. The people that are creating, were such a big part of those negative experiences. There's more of an openness. There's more of an open-heartedness. There's more of a forgiveness, I think, and more of an kind of a like space to be like, okay, this was you, this was me, this was my part in this. It's not my responsibility. It wasn't my responsibility, but like you were saying about, as kids, we take those things on. That space and that separateness has created this self-agency, right? To have a different way and to see a different path and to have this space to be like, we can still have, I can still have this be part of my history. And it doesn't mean these things are true. It doesn't mean I have to carry the shame with me. It just feels so much more distant and separate in their space. There's space for me to have whatever happened. There's space for people to exist in however they exist. It feels so much more peaceful. And I guess I keep saying the word separate. I think that's like really important because I think in a lot of ways, some of the issues tend to be the kind of enmeshment of those things and sometimes relationships. So I hope that makes sense.
Yeah, what was like coming to me as you were talking about it, Elizabeth, is this idea of how, when we experience something that's really painful and traumatic for us, later on, when we recall it, it still feels as if it is present, that it's so close, right? That it's happening right now. And I think that's what you're describing. It's this ability for that to kind of become almost blurry and in the background. It's there, it exists, it happened, you were hurt by it, but it doesn't hurt you in the present moment anymore. And that's that space, that distance. And it is such a peaceful feeling to have that.
Yeah, that's definitely, I think that's such a huge piece of it. You're right, is that the past is now the past. It's not the present, and it is separate. And I found that has been such freedom for me in terms of separating from that and my current relationships and having like these healthier perspectives and a healthier sense of self, which is huge, right?
Yeah, definitely. For all of us. I think it's important as we like share and talk about these things. Sometimes I think clients look at us as though we have everything figured out and, our lives are so put together and we're the expert. And the truth is we're not an expert on somebody else's life. We're only the expert on our own life experience. We might have skills and tools that we've learned that we can impart and educate people with, but ultimately they're the it's their destination, it's their journey, it's how fast they want to go with it. You know, they're the expert in how they move forward in their healing process. And I think that's what I'm finding so exciting about EMDR too, is like what Robert was saying, like EMDR does the work, the client can do it themselves. I'm just kind of noticing what they're talking about. I'm following their lead. And it does give us, I think, that space to say, hey, you know, you're going through this. It's cool. You're going to end up wherever you end up. And I can trust the process because I've been doing it myself on my own stuff that I thought I dealt with in therapy 20 years ago. And I'm a therapist, right? And you know, when that stuff would come up, I would struggle because I go, God, well, who am I to be helping people when I'm still struggling with this thing that I, you know, worked through, I've done so much work around, and yet it still impacts me in these subtle but profound ways. So who am I to be trying to help somebody else and telling other people that it's possible when I'm I still haven't arrived at that myself? Then the other part is, well, it's we're all on a cyclical journey, and at every developmental milestone, we're perceiving our reality through a different vantage point, a different lived experience, more wisdom, and that also shifts the relationship that we have with our past. So I feel like with EMDR, it just accelerates that process. Like I don't have to wait until I'm 75 years old to look back and have that wisdom. It's already in here, and EMDR is like, let's move it forward.
Yeah.
I think Dr. Dobo really, I don't know if he said this originally, but when he called it trauma therapy on steroids, I think that really captures it well. Because it is, like you were saying, all these things, I've talked about them in therapy over and over and over again, but then to do it through this process, you know, there's an action to it. There's a shift. It's like there's a difference between knowing something and then, you know, the insight is great, but what do you do with that? And I think that's where EMDR, I think, has helped people feel less frustrated of being like, I've been in therapy for 20 years and I've talked about this till I'm blue in the face and I don't feel a change yet, or, you know, it's not enough. And I think this is like that shift in that action where people can really feel that freedom to move away from it and really, you know, again, have that space and that peace from the past.
Yeah, for sure. And I know I feel like I deviated a little bit from our original conversation there, where we're going, but I too have noticed some different things in my own personal behaviors after our experience, like EMDR sessions that we did during the training, really allowed me to move through some anxiety that would like stop me in my tracks, that I would have to effort. I would do it because that's what I do. I feel the fear and I do it anyway. I'm like, no, I'm not letting you I'm not letting you lead wheel here. I didn't have to effort. It was easier to do it. I recognized there was still some anxiety there, not anything to where it would have been in a past situation. I was able to take action and it was just easy. And that was powerful.
Yeah, I think when you talk about how that change happens for you, I think a lot of clients wonder how that's going to happen for me. How do I get there? How do I get that relief? Because Dobo. We're going to bring up probably Dobo quite a bit in this conversation, but Dr. Andrew Dobo with EMDR Educators of Florida, little tagline there, was our trainer, and in his first book, I think it was Healing at the Speed of Thought, was kind of that frame you talked about. What was that like little catchphrase that got you to think differently about how EMDR helps trauma or helps that transformational process? And I've been reading his first book, and he just came out with a second book. I haven't gotten to that yet, but I get a lot of questions about from my clients, like, will this erase the memory from me having it? Because there's good and bad parts of that trauma. Like maybe you're on vacation, but then something devastating happened on that vacation, or you got ice cream. Like for me, it was like I got ice cream after a great day of being on a beach here in Sanibel, and then I was airlifted off that beach after like last memory of licking the ice cream because of a car accident, right? Like just really intense moment, but it was attached to something very positive and a very intimate moment with my mother. Like just like a beautiful, perfect day,
Yeah.
and I don't want to lose that. And I think that was like some of that fear of even starting EMDR, at least for me, was, am I going to forget these things? Am I not going to have them anymore? Because although they're traumatic and defining, and this is the other part of it, is what will I be without those?
Yes.
Right? What will I assume to be? What will I look like? How I act and talk if that's not who I am anymore? And I think that kind of like what you were talking about, Raina, last with, like how it changes your perspective on things. It changed your relationship to that stuff. Elizabeth, you talked about the space that it creates between those memories and you. EMDR does not erase your memories. It's not a mind wipe. This is not Men in Black. Like we don't go through that process. A lot of people have always asked me that, but your relationship to those things definitely changes. The way in which we think about ourselves has to change through this process. I think that's a transformation that's the most powerful when I'm talking about it with a client, whether it's something about the future, because we've hit all the past targets and the present targets already, right? And that's that AIM model that we always talk about. Like we can use this for any area of our life. I think kind of what you had talked about, Raina, earlier with like it can be building the positivity for the future, but also I know I experienced a lot of my high anxiety clients, like the fear of like, will I be able to do it? Am I good enough still in the future? Can I produce what I thought I could produce? Is this just something that I've created in my head? Like all those kinds of questions come up as well. So yeah, no, it is not the mind flayer. It's not erasing your memories. You will still have them, but your relationship to them, I think, changes so powerfully. We see these even through like fMRI scans where like you think about the memory. Like if you guys seen some of those images where like it's super activated, like it's all lit up, and then they do the memory after, and it's like maybe like 20% left of that activation level because we created those new neural pathways. Besides some heavy substance users, like the substance from the past, I have not experienced a lot of things that create new pathways in such a quick process, in such a quick way. And I think that's really powerful as well, right? Like I like the neurological stuff. I like the chemical stuff. I like all that stuff because, ADHD, we're neurodivergent. We think about things differently. Our relationship with those things are different. How we interact with those things are different because we literally have reverse processes in certain areas of our brain. Thank you, executive functioning. I got it out today. Sometimes I can't get it out. So, but yeah.
I hear you.
That's all I had was like a grouping of those thoughts and memories.
Yeah, I mean, I think that's the cell, right? And that's like a huge cell. That this is really, there's a lot happening up here that we can't even see unless we're hooked up to an fMRI machine, right? Like that's what's so amazing. But you can certainly, like the proof is in the pudding.
Right, the results in your objective reality, what's happening on a day-to-day basis, it's slightly different, it's subtly different, but the results of those subtle changes really increase one's quality of life.
And I do think it is, back to what you were saying before about, the memory. People are fearful of that. I also think there's a part of them that's fearful of like, well, what does this mean if I'm not someone with PTSD, or I get over my PTSD, quote unquote, or I'm not as depressed, or, I don't have all this anxiety. Who am I then? And what does that look like? And I do think there is sometimes some grieving and loss to that, but I think that that's also very possible. And many people are more ready for that than they think they are. But I think there's kind of just that fear and anticipation around that sometimes. Well, if this is so transformative, well, what does that mean?
Mm-hmm.
Part of my identity that's always been this or that.
Yeah.
Just like any therapy, I guess, right? That fear of change.
It's interesting, right? That earlier you were talking about the all or nothing thinking or the always never thinking, right? This like very polarizing view. And I think that our identity is always changing and evolving. We are not the same people, even if we perceive ourselves to be, right? That's like a little bit of a cognitive limitation that we have as humans. Like we see ourselves as the same because we're living in this body every day. So we don't get that benefit of observing ourselves outside of ourselves. But our identity is always shifting and changing and evolving. It's not a static thing. And I think that if we can have that conversation with our clients when they are talking about, that those fears about their identity changing, how is it going to change me if I'm not this anymore? That can be really helpful. And maybe the EMDR helps hold space for that uncertainty without as much anxiety.
Yeah, that's been a huge target that I've hit with some clients who have had that transformational experience. Okay, well, if the old me is dead or no longer supported because these negative beliefs have been broken in some way, what is that new version? Kind of like what you talked about, Raina, earlier about like creating that more positive view of like using the EMDR, use the positive view. Well, what does myself look like? Okay, all right, let's create an image where we kind of sit, where we create that. And what's that negative belief we have about that? Well, I'm not able to do it, or I feel like I've lost myself, or and that's the other part of this that I think with the EMDR training, or from the EMDR training to now, that's really changed. I used to be very much by the book with those list of negative beliefs about ourselves. That has completely changed. As long as it's succinct enough that we can understand it and it's edible for our subconscious to understand. Like I'm not making contractual statements here about like, if I could do this, then that, right? Like, but if it's like, I have no control, like those are the bigger ones, right? But like I'm stuck, I suck, like I'm shitty, I'm a shitty person, like those are all things that people think and believe about themselves from time to time. And those can be the negative beliefs that we break. Or, I'm not a shitty person, is like I care about people, or like I always try, like I'm always trying to do the right thing, or I am capable of reliving this experience in a new way, or like that's a little bit more contractual and maybe a little bit too long. But I love that part of it as well, is that you can customize, or you can be open to that part of yourself that is completely unique to that client's experience. It doesn't have to be by the book. It doesn't have to be that. And I think that's also, it's double-edged sword. Scary for our anxious, depressed, PTSD. Like myself, I was scared of that, right? Like what am I going to become like after this? I am so much happier of a person now, having gone through EMDR. I enjoy so much more of my existence. I'm not afraid of the things that that was supporting my fear about myself or my lack of ability, and that if I can give that even just glimpse of that or moments of that with my client, we begin to piece that together and then have those sessions in between where we kind of build up that esteem, we build up that self, we build those connections more with the other things that have happened. Like, oh yeah, we did this memory, but do you remember this and this and this that happened? Oh yeah, it was all tied to that I don't matter. I'm not fucking good enough again. Sorry. But like,
Exactly.
you know, those beliefs about ourselves also can change the way in which we think and believe about ourselves. But yeah, I love using those future targets for like who am I going to be? How do I want to live? Like answering those questions, because those are things that we all think about now that changes happen. What is this? Who's this person? What is this amalgam of ideas and beliefs and personality traits that we have? So I know you're
Can I
itching over
ask
there,
you?
Elizabeth. What do you got for me?
Oh, yeah, no, I'm
Yeah.
wondering about the future templates. I've only done that like once or twice. When you're doing it, have you started with those typically? Have you just come to a point where maybe you've done a couple other events and then you're doing it because something else came up? I started with a client doing that, and it was a really good intro. But so I'm just curious how you've used, if you don't mind sharing a little bit about the future templates and what you've seen.
Yeah. I'm interested what Raina has to say about this, because I think she's built a lot of this, it sounds like, with certain clients as well. So please feel free to jump in.
So,
My way of doing it, or the way in which that I've kind of gone about doing this, is usually it can be someplace where we start. Like, we always start with a present issue, like let you understand the function of EMDR in some way, the structure, how it works, you know, writing a protocol, like all like the steps that we do have to take that make this method effective, right? But then also, what I'm focused more on is what is the greatest need for you right now, right? That's what I'm asking them in that question. Sometimes it's what is the most distressing, but what do you want to be? So, an example, I've done it two different ways. The most recent one is we broke a negative cognition about someone's performance at work. Someone got fired who was their mentor, their boss. That they believe like everyone around them who's a mentor always fails them in some way. So like, you know, like they thought they were the problem, and this is a young individual who is very talented in what they do, right? Like probably someone who would classify as a genius level like individual. Like he can he can do so many things, right? So then we focused on, well, now that the mentor's not there, they're relying on me for these things and looking for me for guidance and direction. So we're putting them in that setting, right? And what is that negative belief we have about this person, about ourselves in that moment, right? And then we install that positive cognition after we've broken that negative cognition. So that's one way that I utilize that future template, or like future worries, future anxieties. Will I be able to perform? Will I be able to do those kinds of things? And then the other one is kind of more along the lines of what Raina had talked about earlier, which is like, I want my life to be better in some way.
Yeah.
I want to feel like I matter, like I'm good enough, like all those kinds of things. And then it's kind of like a negative way to start thinking about that, but that's why they feel stuck in that moment. So what does that look like for me? I want to be more positive. I want to be happier, right? That's a big one for a lot of people, the pursuit of happiness, right? And so, okay, so you're pursuing happiness. Where's your happy place that you want to go? And not like using their happy place, if you will, for that, or their safe place, but like a place that they feel happiness, that they want to see themselves in a future oriented goal, whether that's at work, a future, you know, moving from Connecticut to Florida, using that template, like what does that house look like, all that kind of fun stuff, and then their belief about that as well. And then when we go in with that body scan, all the same stuff. So that's how I've been utilizing that future template. I don't know, Raina, if yours has been different or not.
yeah, so it's kind of evolved, right? I have like one client where we had been processing some pretty difficult stuff um, and getting stuck, and we just really needed to focus and shift it into the positive for them. And so that was more on like building their own capacity and the inner resourcing to see themselves in the future as being able to handle and navigate certain situations that were contributing to a significant amount of stress in their lives. And thank goodness we have, as part of the training, these consultation calls, and I was able to like bring that up. And Sandra, who I've been doing the consultations with, she ended up emailing us some different resources for that specifically. And so I was able to use that template to help this particular client, which was awesome. And I think it's a great template, and I'd be happy to share it with you guys too. So share the wealth. And then similar to what you were talking about, Robert, that piece of like, no, I want something different for me in the future, but I don't know what it is. And using EMDR almost like a creative visualization process to visualize what that life looks like, you know, a year from now, 6 months from now. What does that look like? Where are you? Who's around you? You know, just really getting into the picture. And that was really cool to witness. So somebody that I was doing this with, they said, I never would have allowed myself to imagine what I imagined for myself. But
Mm.
now it feels like it could be real. That it is possible for me, that that future is possible. That's powerful.
It's so powerful. It sounds so transformative and it's amazing. I am getting so excited about this. It feels like sometimes the EMDR scripts are endless and it's so exciting. Like it feels like a kid in a candy store. You can never try every single candy and there's so many different options. It's like,
Yeah, it's a creative
amazing, right?
process.
It's so
Yeah.
amazing to think that this can be so transformative in so many different ways, on so many different levels, so many different parts, aspects of people's lives. Like,
Yeah, it is cool. And I think that's just as important as like breaking down the negative beliefs too, right? Really being able to see, you know, possibilities for oneself beyond what you've previously imagined for yourself because of those old cognitions that were clogging the pipes, right? Like once you start to break that up, now things expand, right? There's greater possibilities for the future because those limiting beliefs aren't as they're not kind of making your vision so myopic. And there's that expansion there. Well, now I can see myself having this life I never thought possible, but now I can see it. Now that they can see it, then they can make it real, because now they can make decisions and choices in their life that align with that future template, that future vision for their life. That's cool.
And EMDR will take that process because, you know, sometimes it does go negative with it. Like, I don't know who I am. I don't know what I'm going to do. I don't know how to do this. Like all those like kind of
Mm-hmm.
new negative beliefs that your anxiety may float towards, right? To replace those old negative beliefs that we had held on to before, right? So when we do the future targets, it's breaking those before they become installed, right? Like it's almost like, you know, like we're not going to allow those to become the sticky points in our future. That's why we're doing the future targets. At least that's been my experience so far.
Yeah. And as a supervisor, I had a number of folks that I supervised testing for their license, and and people aren't passing this new test. And I've been encouraging them to go and work with somebody doing EMDR in order to imagine themselves being successful taking that test and passing that test, because it's so anxiety provoking, because there's so much writing on it and it's so expensive, you know?
Yeah, I can concur on that new test. It took me twice to get it to pass. So,
yeah. Yeah, for a lot of people, I'm hearing that. As is with a new test, they're probably going to use all these first test takers as kind of experimental, and then
pilot,
yeah, thank you, pilot, and then tweak the questions as they move forward. but I don't know anybody that has passed on the first try yet. So yeah.
Yay.
Well, as kind of we wrap up, because I want to be mindful of everyone's time today, as we wrap up, if there's one thing that you would like to share with people that are contemplating taking this, taking that step into saying, you know what, I do want a different life for myself. I do want to let go of this past sticky stuff, and I'm ready to take action and come in. Anything you would want to say to somebody in that position where they're kind of thinking about it, not sure, but want to?
I would say you've already done the hardest work. And there's, you know, there's these like points of overwhelm and feeling awful in processing, right? And I think the payoff is so great and so worth it. And, you know, I can't think of another word besides transformative, impactful, powerful, you know, just freeing. I mean, connecting, freeing, you know.
Yeah, love that.
I'm actually staring behind the camera here. It's called the Pyramid of Transformation.
Ooh.
Like, you know, like I've been staring at this the whole time, right? And I think it's interesting because like EMDR can do it all in one session, right? Like instead of like we're building awareness, creating responsibility, seeking forgiveness or releasing shame or blame about ourselves, and then finding peace and joy, like that can happen in one session. So you can take years in psychotherapy or regular talk therapy to do that. And I'm not saying that there aren't therapeutic approaches that are quicker, right? But the effectiveness, the rate at which healing can occur is, I think, the most powerful part of this for me. And what I'd like to underscore for anybody who's interested in EMDR is you don't have to wait on your healing. Like you can get it today. And anything you don't want to work on, you don't have to. You are that driver. You are that person who directs your own path of healing and discovery. So if you're not ready to take a step in that direction, that's fine. EMDR therapists or therapists in general aren't going to force you to do something you don't want to do. And if you are being forced to, I mean, within reason, right? But you know, like I'm not going to make you do certain things, but I will challenge, right? Encourage, promote, like, yeah, of course. Yeah. All those things. Good therapy.
Because you're always in control because the client is always in control, right? No, is right. But I get it.
Right. Yeah. And it's a collaborative process, right? You're seeking advice, you're seeking help, you're seeking support in some way. And we will always be that for you. But if you choose not to work on something, and this is the thing that I always tell people as well after we do an EMDR session or when we're doing a consultation for it, is you're going to take that with you.
Yeah.
So if you want to hold on to that, that's perfectly fine. I'm not going to challenge you to do that. When you're ready to face that, we'll face it together through this process. And it can be healed within a session or a couple of sessions. Yeah.
I love that. I don't have anything else to add because you both said it perfectly. It is possible if you're willing to come in and do the work. And I think it's certainly it's easier than we perceive it to be, right? And the painful part is small in comparison to the amount of pain we experience in our lives as a result of not taking care of that wound within. So in that way, it's like, ooh, I can tolerate that for that short period in order to experience this freedom and possibility and ease in my life. Yeah. So,
yeah. And I'm so grateful for you all both and being able to learn with you and being in your class and training with you. It's just been, I think that's been a major, amazing part of the training too. So.
Yeah, I definitely think the amazing, not to say there weren't other groups that were amazing, but the amazing connection we've made through this process and meeting you guys has encouraged me to be more collaborative in other ways as well, not just with other therapists, but in general. It's like, well, maybe that anticipatory anxiety really isn't the thing that I allowed that controls me. Like you kind of talked about, Raina, like I'm gonna power through that, right? Like I'm gonna get through that. But you guys are such genuine, honest, and real people. I enjoy being your friends outside of this podcast room as well.
Hmm. I'm I'm lost for words because yeah, it was great. That was a great part of the training, was a time that we spent together and the work, the deep work that we did together, and that we really held that space for each other to go into um, really true places that were in need of healing. And I think that willingness to be vulnerable together really helped create that connection. And I'm grateful that we all went to that particular training. It was like synchronicity, if you will. And that here we are, we decided that was so great. Let's talk about and share our experience with others, so that other people can really learn and possibly receive benefits that working with somebody who's trained in EMDR has to offer. And on that note, if somebody did want to reach out and they're in the Connecticut area and they wanted to work with you, Elizabeth, what's the best way that they can find you?
Best way to find me is that to email me at therapywithelizabeth@gmail.com. And I also have a website, which I can never remember exactly. I am unfortunately full right now, but I still do a lot of groups, and depending on what's going on, I do consultation too. So, and I'm happy to try to help people get referrals and whatnot. So other resources.
Perfect.
My email is, or my website is therapywithelizabeth .webs.com.
Webs.com.
Mm-hmm.
Okay. All right. And how about you, Robert?
Well, I think you know how to get a hold of me. No, the best way to get a hold of me would probably be reaching out on our website. We have a pretty um, a pretty easy way to get there. So it's bg-counseling.com. So verygoodcounseling.com, basically. Or bg-counseling.com. Sorry, scratch that middle part. That's another person's website in Colorado. But yeah, that's the easiest way. Or email me at vg or bgcounseling@gmail.com, or vg2@gmail.com, or robert@bgcounseling.com. I have 3 emails.
That's a lot of
Yeah.
emails.
You have no idea.
But the other thing, if people are, reaching out, Robert's wife, Elena, also is an EMDR provider.
And a consultant.
Oh, she's official consultant. That's so exciting.
Yeah.
Yeah. All right.
I mean, in training, but we're starting that avenue as well. So you'll be seeing some more posting for if you need consulting with EMDR, you can meet with her. So I get some free in-house stuff, and we also have that arm that we're branching out into.
Wonderful. That's fabulous. And if you wanted to reach out to me or any of the other therapists in the practice, there's 4 of us that are trained in EMDR. And the other therapists also happen to be art therapists as well. So we use a lot of imagery, and we didn't talk about that part, but like using people's adaptive shift imagery to create art about that image at the end really powerful stuff too. But you can reach out to us at www.floridaarttherapyservices.com, or you can email me at Reina, REINA, at floridaarttherapyservices.com. Thank you all so much for doing this and making the time to have this conversation today.
Thank you for having us.
Yeah.